Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annosodas Vyadhi and we have discussed in detail Chardi Atisar. I have tried to explore between the lines of the Samprapti as well as application of Sharirik Kriya regarding these two diseases. Today we will take another chapter, another Vyadhi, very easy for diagnosis and many a times a very uh, irritating for the patient. And the subject is Malav. I have said specifically Malav and not Malavashtamba because in Sharir Kriya, Purishasya, Avashtamba Purishasya is a Prakrut karma of Purisha. So, in my opinion, Malav is a more proper word when it comes as a disease. Now, diagnosis is very simple. Patient himself complains of the constipation, and you will find that many more uh, patients always come with this symptom frequently. You will see in few years back that only old age people were suffering from this because of the dryness and the age related factors, but nowadays because of sitting professional sitting job, change lifestyle, change food habits, you will find this complaint in almost all types of age groups. It starts with the malarodh, and if it doesn't get cured properly, then you will see that it goes further to fissure, piles, ulcer, etc. So let us discuss malarodh in detail, because in this case the diagnosis is very easy. Patient himself tells you about the complaint. Treatment also easy because you know so much of laxatives, like right from dugdha with ghee, black grapes, triphala churna, sukasarak, up to ichhabidhi like kalpa. So diagnosis is easy. Treatment, there is much more options available to us. The question is not about diagnosis of the other culprit to be used as a treatment. Question is how we should eradicate this complaint permanently, so recurrent complaint of constipation will not occur. See, this is the main part of this complaint. Patient tells you that you give medicine for the motion, I feel very better. As soon as the medicines get stopped, the complaint again, the reoccurrence of the complaint is seen. So patient gets fed up with the constipation as well as to take the medicines frequently. So in my opinion, the treatment part is easy. Diagnosis is open secret in sort of, but we should think about the eradication of the complaint permanently. At least the frequency of constipation should be less seen in the patients. And let us in this lecture focus on these factors. So in short, what is the reason of the constipation? It is just mainly Krura, and the Krura, it means a dryness of the intestines. Now it is by nature in some of the patients, first things. Second thing, change food habits, in which there is always you will find as a hetu eating the dry food. There is no liquid diet. Patient eats very dry food like bread, pizza, or even there is no any liquid content like dugdha, takra, soup like that in the regular food. They eat only chutneys or with food or dry vegetables and chapati or poli, etc. So these things add to the dryness of the body. Third thing, which is very important, you should ask the patient that intake of water is also less. Specifically, in rainy season it is less, but in hot summer also, if the patient is working in the air condition, which is very common now, they don't feel thirsty and automatically intake of water is less. So the first reason you have to uh, think of the crudo coaster and ask the history according to the patient. Secondly, dry food, less intake of the water. Fourth one, which is very common in the young generation, is Jagran. Jagran, in the properties of the Jagran, it is said that it is Ruksha. It increases the dryness of the whole body, including intestines. You will find young generation has is on laptop, on mobiles, maybe for the work, or many times students just have a habit of late night sleeping because of this laptop and mobile. You will find this is a very important hetu you will find in today's practice. So you have to think all these factors when you are going to give the treatment, because if hetu parivarjan is not done, it will be only a symptom treatment and patient will come to you again with the same complaint and with the increasing irritation of his mind. Along with this, many a times you will find that I have seen in the patients that if a patient is taking medicines for the prameha or sthaulya, there are, especially Ayurvedic medicines I am mentioning, that they all contain ruksha guna to reduce the kapha or a cleaver. So ask the patient if he started constipation after start taking these medicines, and you have to keep in mind this thing also. Age factor, yes, in old age, natural dryness, vata prakop. Secondly, with the sitting job, you have to ask the patient where it is a traveling on the two wheelers. It is also adds to the this factor, because the constant vibrations or jerks on the two wheeler also add to this uh, as a hetu of the constipation. Another hetu which is very commonly seen is chinta, constant depression. Again, chinta increases ruksha guna in our body, so think of that factor also. So before treating constipation, just rule out whether it is natural chlorocosta, dry food, less intake of the water, jagaran, sitting job, chinta, and all these factors add to the constipation as a hetu. Another, in young generation you will find another hetu, excessive gym. It increases vata prakop and dryness is also increased. So there is a tremendous you can say awareness or fad, what you want to say, but people go in the gym, they go very hard work for building the muscles, or in to reduce the weight also, they do very hard work, less diet, and that adds to the dryness of the intestine. So before treating the constipation, which is very easy to treat, you know, just rule out what is the cause behind that, and unless and until you convince the patient to rule out that cause from his lifestyle, the constipation treatment will not be complete. We will move towards the constipation treatment in the next lecture, and we will see how to deal with this problem. Thank you very much.